In a groundbreaking advancement for cancer treatment in India, patients across South India are showing exceptional recovery rates from blood cancer, such as leukemia and lymphoma, through a revolutionary form of immunotherapy known as CAR T cell therapy. To explore more, we have with us Dr. Vishwanath S., a senior medical oncologist at Apollo Hospital in Bengaluru, who specializes in various cancers and in CAR T cell therapy. Welcome, sir.
Thank you, Anuba, and happy to be part of this video and looking forward to your questions.
First, sir, I like to know what makes CAR T therapy such a game changer in treating relapsed leukemia and lymphoma cases.
Yeah, that's a nice question to start with. So we do understand that blood cancers in the upfront setting, that is initially when they are treated, for example, lymphoma, which is the cancer of the immune cells, around 60% of them are curable. But what happens in the relapse setting? The patient, the disease does not respond to conventional chemotherapy, and the disease comes back with a bang. And that is when the there is difficulty in treating these patients and achieving a cure. And even procedures like autologous stem cell transplantation have been able to achieve only 30% cure rate. But here is where the major revolution with CAR T cell therapy, for example, a high grade B cell lymphoma, what we say, arising from the B lymphocytes or B immune cells in the body, can be successfully treated with CAR T cell therapy, and we can achieve around 50 to 60% of cure rate and long term survival, which is a great thing in relapsed lymphomas.
Okay.
Similarly, in children and young adults, there is something called B acute lymphoblastic leukemia or blood cancer, and these cancers are not good at all. And left alone, these patients will not have a good survival at all, and most of them would die within the next 1 or 2 years. In such situations, again, CAR T cell therapy is a game changer, and we've been able to achieve cure rates in around 40 to 50% of the patients.
Okay, great. Right. So, sir, can you walk us through how a patient's T cells are genetically engineered or reinfused?
Yeah. So this procedure, CAR T cell therapy, is also called as Chimeric Antigen Receptor T-cell therapy.
Right.
So the procedure is basically done like this. So the patient undergoes a procedure called apheresis or extraction of the T cells from the body. So a central venous catheter is put, a big catheter into the large vein here, and then the procedure, just like removing blood from the body. It's called apheresis, and this procedure is done, and that it's basically the extraction of the T cells.
Okay.
Once the T cells are extracted, it is sent to a lab,
Mhm.
and there these T cells are genetically modified and reprogrammed to kill the cancer cell.
Okay.
This procedure takes around 2 to 3 weeks, generally around 21 days.
Right.
Before the T cells are back, the procedure, the entire manufacturing, expansion, and all that is, and reprogramming and all that is done. It takes around 3 weeks. Just 1 week, maybe 1 week prior to the T cells come back, the patient is admitted and given what is called as conditioning chemotherapy. Some kind of chemotherapy is given,
Okay.
and then again the reprogrammed T cells which are back, that is infused back into the patient's body, and then the patient is monitored for the next 2 to 3 weeks in the hospital for various side effects. Sometimes the patient develops seizures, or the patient develops fever, chills. All these things are monitored. That is a reaction to the T cells, the reprogrammed T cells. So the entire procedure takes around 3 to 4 weeks, including the manufacturing of the T cells and the patient's monitoring.
Okay. Right. So, what criteria do you use to determine if a patient is eligible for CAR T therapy?
Yeah. So there are various factors: the patient's age, general condition,
Mhm.
And then with the patient has got other comorbid conditions like diabetes, hypertension, heart disease, kidney disease, liver disease,
Mhm.
and the patient's disease status, how much the patient, how bulky the disease is, whether the patient has responded to any kind of chemotherapy, what type of chemotherapy the patient has received before.
Okay.
All these are factors which have to be taken into consideration before embarking into this procedure.
Mhm. So, how do you mitigate common CAR-T related side effects like CRS or neurotoxicity in your trials? Or tell us more about these conditions or side effects.
Yeah. So most of our audiences are probably non-doctors. So let us make it very simple. So like Anubha, you said CRS. CRS stands for cytokine
Okay.
release syndrome.
Yes.
In our body, because these T cells are infused back, there will be some kind of a reaction. There will be inflammation. Inflammatory mediators are released, and that can lead to this process, this common side effect, which is called cytokine release syndrome. The cytokine release syndrome, again, there are different grades. Sometimes the patient can just have simple fever, little bit of chills. It may progress more, and the patient may have breathing difficulty, or sometimes the patient may have low blood pressure.
Mhm.
Depending on that, these patients are managed. So
Okay.
whenever there is just fever, we can manage with simple paracetamol kind of medications.
Mhm.
But when the patient has a higher grade, like breathing difficulty or the blood pressure drops, we generally tend to give a drug which is called as tocilizumab to to mitigate this CRS.
Okay.
Similarly, there are certain neurological side effects, like you mentioned. The patient may develop altered mentation, may develop seizures.
Mhm.
So these are also managed similarly,
Mhm.
and there are other drugs also to manage these
Okay.
conditions.
Right. Right. So, what were the specific challenges or complexities you encountered initially during the therapy process or trial phases?
So this procedure requires a lot of infrastructure, and
True.
it requires a proper bone marrow transplantation unit,
Okay.
and it cannot be done in every ward or floor.
Mm.
So, and it is just like the typical stem cell transplantation unit is used for this CAR T cell therapy also.
Okay.
Similarly, in India, we have a few centers, mainly the a couple of centers where these CAR T cells are manufactured. So we can, in fact, only one center as of I know. The other center is actually we get the CAR T cells from elsewhere, but it's mainly indigenously. If you see, it's done only in one center, and we should have that kind of infrastructure. And of course, bioeconomics plays a big role
Mhm.
because it's an expensive procedure, and the sending the CAR T cells and getting it back, and all, and using all these drugs for mitigating the side effects, monitoring the patient, all this involves a lot of cost as well.
True. So, sir, one of the most compelling success stories comes from Narayana Health City in Bangalore recently. There were three patients treated for relapsed lymphoma using CAR-T therapy have now completed over 3 years of remission. So, can you share any such success story from Apollo, and what does such remission means, in terms of clinical significance?
Yeah, so our patients do not have such long follow-ups,
Mhm.
but shorter follow-up they have done well. Yeah,
Okay.
I would say few months. But most importantly, like I said, it depends on multiple factors. The disease status before doing the CAR T cell therapy is also important.
Mhm.
If the patient has got very minimal disease,
Mhm.
the chances of this patient having a long-term response and remission due to CAR T cell therapy is higher as
Okay.
compared to doing CAR T cell therapy when the disease is widespread.
Okay. Right. So, how would you compare patients' recovery post CAR-T therapy to those undergoing conventional therapies or chemotherapy or radiation?
Yeah, that's a great question. So, post CAR T cell therapy, the first 2 3 months may be a little tricky. We have to manage any possible infections. The initial phase, we know we have talked about the CRS and the neurological symptoms. Once a patient gets discharged, we have to be very careful about any infections, And sometimes the immunoglobulins, the body's immunity comes down, we might have to give immunoglobulins to take care of that. But other than that, once they are out of the hospital, it's very unlikely to have any life threatening issue, and it is generally a smooth process.
Okay, right. So with two therapies, Nexcar 19 and this Coartemi now approved by CDSCO, Central Drug Standards Control Organization. So how has this impacted the cost and accessibility of the treatment?
Yeah. So definitely the cost of doing a CAR T-cell therapy in India is probably one-tenth of the cost which is incurred in the United States and probably other countries.
Mm,
So still it is quite expensive. It comes to around 50 to 60 lakhs. And that's quite a lot for a low and middle income country like India.
mm,
And patients find it very difficult to afford this kind of a treatment. Having said that, definitely yes, as compared to in the United States and in the West, the cost is one tenth in India,
mm,
and hopefully the cost will come down further so that more patients have accessibility to this novel treatment.
mm. Could you tell us more about your upcoming trials for multiple lymphoma and leukemia patients?
Yeah, see, as such, I don't have any clinical trial running for multiple myeloma,
Okay.
but we have done a couple of studies for relapsed lymphomas,
Mm,
and mainly looking at the epigenetic and very deep, what is called as NGS, next generation sequencing, and looking at possible mutations and resistance mechanisms in diffuse large B cell lymphoma.
mm. Okay. And do you foresee CAR-T therapy becoming a standard line of treatment in India's public healthcare system in the next few years?
Yes, definitely. I think it has shown a lot of promise.
Mhm,
And yeah, I'm sure in the next few years, we will see CAR T cell therapy becoming a standard line of treatment in the relapsed cases. And not only that, even the upfront
mhm,
patients who are initially treated with chemotherapy. Now there is a lot of clinical trials are being done in the United States and other countries in the upfront setting. Hopefully, that also will get FDA approved, and hopefully, those drugs will come to India. And not only that, our indigenous CAR T cells also may start working in the frontline setting. And in the next few years, we might see this as a standard line of treatment.
right, sir, right. Right, sir. Thank you so much for this insightful information. Thank you. Thanks a lot.
Thank you. Thank you so much for having me.